Lots of people get their gallbladders out each year, usually because of gallstones. It's one of the safest and most common surgeries in modern medicine. Most people recover quickly, feel better, and get back to life. But here's the part that rarely gets explained. Your digestive system will be changed forever after your gallbladder is removed. Not in a frightening way, but in a subtle way. Social media has a lot of fear based stuff. Fear could be used as a tool to get views. Seneca said, ignorance is the cause of fear. So let's replace fear with understanding. Because today's topic is something that really stresses out patients before gallbladder surgery. Hi, I'm Gaurav and you are watching Gut Instincts. Today, we explore the question, what are the consequences of gallbladder removal? Spoiler alert for today. I'm not here to push this surgery on you. I really want you to keep an open mind during today's talk. I have tried to be fair and balanced, combining the latest research with my own experiences. Feel free to disagree with anything I say, no problem. However, you should really do your own research from a trustworthy medical source, not just blindly follow an influencer. Early gallstone surgeries, more than a century ago, were designed to remove only the stones. These methods were not very successful at providing a long term fix for issues related to gallstones, and gallstones kept coming back. Repeated treatment felt more like a subscription plan. Maybe today's private equity backed healthcare would probably love it. Anyway, actually, in those days, surgeons believed the gallbladder was essential for life until Carl Langenbew removed one intentionally in 1882 and proved that wrong. Then came 1985, the first laparoscopic cholecystectomy or keyhole gallbladder removal surgery. It changed everything. Smaller cuts, faster recovery, and a massive increase in the number of surgeries. And thousands of patients had an easier and permanent fix for their gallstone related troubles. A scientific way of thinking means we always try to understand things in a better way. So, with more surgeries and a longer term follow up of these patients, we learned that gallbladder, though not essential for survival, plays a subtle but important role in digestion. The inaugural video on this channel, titled Why Do We Need a Gallbladder, thoroughly covered this subject. We'll go through it briefly now. Think of the gallbladder as a bile acid warehouse. Bile acids are chemicals present in bile and are produced by the liver, and they are very important in the digestion of fat. Gallbladder stores bile and concentrates it, and it releases bile in controlled bursts when you eat. After gallbladder removal, there is no warehouse for storage. Bile drips continuously into the intestine. The timing becomes less coordinated. The intestine has to manage everything on its own. Most people adapt beautifully, some adapt slowly. A small group struggles with symptoms. This is not because the surgery went wrong, it's simply because the digestive system has lost one of its regulators and the body has not fully adjusted to it. Post-Cholecystectomy Syndrome or PCS is a fancy term for symptoms that continue or appear after this surgery. Medical people love to coin smart sounding phrases. PCS affects 5 to 40% of people. That's a wide range because the causes vary. So, why do symptoms persist or recur? Left behind stones. Tiny stones may sometimes remain in the bile duct or in a small remnant portion of a gallbladder. Other digestive problems that were always there, IBS, reflux, or acidity, won't magically disappear with gallbladder removal. If those caused your symptoms in the first place, they are bound to recur. No surprises here. New issues created by altered bile flow. The body must adjust to continuous bile flow instead of timed release of bile. If it doesn't, then issues arise. Rare surgical complications such as bile duct strictures or narrowings. Half of PCS cases are due to bile related issues. The other half are unrelated digestive conditions that were simply overshadowed by gallstones on scans and manifest overtly later. We'll cover this topic in greater detail in a separate video. Diarrhea after gallbladder removal can be seen anywhere from 1 to 35% of patients, depending on how you define it. Here's the simplest explanation. Without a gallbladder, bile flows constantly into the intestine and more bile reaches the colon. Bile in the colon acts like a natural laxative. The colon pulls in more water, result loose stools or urgency. Some people experience this only occasionally. A few may experience it daily. Most improve with time. Why does it vary so much? Because everyone's colon and gut bacteria react differently to this altered bile flow. So, what's the treatment? Diet changes. Smaller meals, less fat at once. There will be detailed video on diet later. Bile binding powders. They soak up excess bile in the colon. Newer medications, which can reduce bile production at the source. Most people find a combination that works. Nearly half of patients develop some degree of bile reflux into the stomach over the years. Why? Because the gallbladder normally helps coordinate bile flow with the opening and closing of sphincter of Oddi, the tiny valve controlling bile entry into the intestine. Without the gallbladder, the timing becomes less precise. Bile can move backwards into the stomach. This can irritate the stomach inner lining. Symptoms include upper abdominal discomfort, nausea, bitter taste, bloating after food. People with diabetes, obesity, or H. pylori infection are more prone to this. As the old saying goes, the right thing in the wrong place becomes the wrong thing. Bile is helpful, but not when it's splashing into the stomach. If a patient develops symptoms, there are medications to take care of them. Sphincter of Oddi dysfunction. The sphincter of Oddi is like a gatekeeper. It opens to let bile and pancreatic juice flow into the intestine. After gallbladder removal, the hormone that normally relaxes this wall becomes less effective. The wall may stay tighter than usual, contract more frequently, cause pressure buildup. This might lead to the same old classic biliary pain after gallbladder removal, but often without obvious findings on scans, and the patient and the doctor might wonder that a ghost of gallbladder is causing pain. Sometimes the diagnosis can be difficult. Treatment exists, but appropriate patient selection is crucial for a good result. Recent research reveals a modest increase in the likelihood of colon cancer following a cholecystectomy surgery, with a particular tendency for the right side of the colon. Why the right side? Because that's the part of the colon where bile acids present in bile are most concentrated. The simple explanation: continuous bile flow, more bile reaches the colon, bacteria convert this excess bile acids in the colon into more irritating forms. These can inflame the colon lining over decades. Yes, over decades. And chronic inflammation increases cancer risk. This does not mean everyone is at high risk, and there is no need for panic. I hope that the social media influencer gang doesn't learn this fact. They will spread the fear like a wildfire with panicky thumbnail. Timely screening as per already existing norms and healthy lifestyle after this surgery are crucial. This concept is still evolving, and future research on this subject could give us more insight. Bile acids are not just digestive juices, they are metabolic messengers. They talk to the liver, pancreas, and even fat cells. Yes, there is a lot of gossip going on inside our bodies too. After gallbladder removal, the pattern of bile acid release changes, as we discussed before. This can influence fat metabolism, sugar regulation, and fat accumulation in the liver. This change can temporarily stress your heart and metabolism for about 2 years. However, once your body adjusts, your health often improves because the symptoms due to the inflamed gallbladder are gone. The main takeaway is that for most people, the body adapts beautifully. If you already have healthy habits like managing weight or blood sugar, it just means you should stay consistent with those habits to help your liver adjust to its new rhythm. It isn't a cause for alarm, but a reason to keep prioritizing your overall metabolic health. Now, let's bust some myths. Playtime. Myths surrounding gallbladder removal spread easily because people often confuse correlation with causation. Just because two things happen together doesn't mean one caused the other. For example, books in the background of a YouTube channel don't automatically make the host wise. This is an illusion created to confuse correlation with causation. By that logic, people like me who mainly read ebooks, we can never look wise.
बात तो सही है.
Sometimes people just misunderstand what the gallbladder actually does. Let's break down these myths using first principles, the simplest building blocks of how the body works. Myth 1: I'll never digest food normally again after gallbladder surgery. First principle: digestion is controlled by the liver, pancreas, stomach, and intestine, not the gallbladder. The gallbladder is a storage tank, not a factory. It does not make bile, it only temporarily stores it. After its removal, the liver still makes the bile continuously, the intestine still absorbs nutrients, the pancreas still releases digestive enzymes. So, digestion continues, just with a different rhythm. And most people absolutely don't sense it. Think of it like switching bile output into the intestine from a bucket pour to a steady tap. Different style, same function. Myth 2: I'll need lifelong medicines after gallbladder surgery. First principle: the body is incredibly adaptable. Most people need no long term medications because the liver adjusts bile production, the intestine adjusts bile absorption, the colon adjusts water handling. Only a tiny percentage might need long term medications for various issues we discussed. For the majority, simple dietary changes, that too in the initial phase, smaller meals, less fat at once, are enough. Myth 3: I'll gain weight because of the surgery. Not a popular myth, but let's discuss it anyway. First principle: weight is determined by calories, hormones, and lifestyle, not the presence of a gallbladder. The gallbladder does not control metabolism, appetite, fat storage, blood sugar. What often happens is this: before surgery, people avoid fatty foods because they trigger pain. After surgery, they feel better and eat more freely. This behavioral change, not the surgery, can lead to weight gain. The surgery itself does not cause weight gain, lifestyle does. So unfair to blame the surgery for lack of personal dietary accountability. Myth 4: This surgery will fix all my stomach problems. First principle: a tool can only fix the problem it was designed for. Cholecystectomy fixes gallstone related problems, biliary colic, gallbladder inflammation, stone related complications. It does not fix IBS, acidity, reflux, gas, and bloating. These conditions have completely different mechanisms. A gas stove lighter cannot be used to light a candle. It was not designed to do that. Myth 5: The long term risks of gallbladder surgery are huge and unavoidable. First principle: risk depends on the person, not just the surgery. For most healthy individuals, the liver adapts, the intestine adapts, the microbiome stabilizes, symptoms settle. Long term risks mainly affect people who already have metabolic vulnerabilities: obesity, diabetes, high cholesterol, poor dietary discipline, bad sleep hygiene, or sedentary and stressful lifestyles. In other words, the surgery doesn't create the risk, it reveals the risk that was already there. As the proverb says, the same wind blows on us all. It's how we set our sails that matters. Let's think about the advice doctors should give patients before they have their gallbladders removed. Good counseling includes clear indication. People with classic gallstone pain and complications benefit the most. Honest expectations. Most symptoms after surgery settle within a few weeks, the rest in 3 to 6 months. Metabolic risk assessment. People with metabolic syndrome, which includes obesity, diabetes, and many related issues, need closer follow up. Reassurance. Long term quality of life is excellent for most. Transparency about rare complications. Bile duct injury is rare but serious and must be discussed. Cholecystectomy is a triumph of modern surgery. safe, effective, and transformative for the right patient. But it also teaches us a deeper truth about the human body. Every organ matters, even the ones we can live without. Removing the gallbladder doesn't break the system, it simply forces the system to reorganize. Most people adapt beautifully. Some need guidance, a few need long term monitoring. The key is knowledge, understanding what the gallbladder did, what changes after removal, and how to live well without it. There's even a nice quote about this. The gallbladder is not essential for life, but its removal must be justified by life. It means that something, even if it's not vital for life, still deserves respect before you get rid of it. Just because you can remove an organ doesn't mean you should treat the decision like deleting a file. Biology doesn't have an undo button. However, when it is actually causing you trouble, there is no point in continuing the suffering due to a weird sense of attachment to your malfunctioning body part. Today, with better science and better patient education, doctors must try to ensure that justification is thoughtful, informed, and tailored to each individual. Thank you very much for your patient listening. I hope I have shed some light on this frequently asked question. Please share it with a patient who has this confusion before undergoing treatment for gallstones. And for those of you who would never let go of this body part, even if it's cursed, I am ready to accept all the trolling in the comments. See you next time on Gut Instincts. Bye.